A quick detour on how our business actually works. This is a bit of a look behind the scenes of how an insurance company operates. Of $100 we take in on premiums, we pay out about 85 directly for medical spending. We use about 12 to pay for our own operations, meaning our engineers here, our customer service agents, our claims processors, and so on. A little bit we keep as a profit, about 3% industry-wise. Now let's dig a level deeper into those medical costs. Here's a way we can break those down. Risk per member, first components. The word risk is a funny one here because we use it because every insurance company talks about medical risk that way, but it sort of implies, again, how insurers like to think about you as a member. You're a risk to them almost. Apologies for the terminology here. It's the way, essentially, insurers call the amount of health conditions you have as a member. Utilization per risk then is how many times do you end up using the healthcare system if you have certain conditions. If you have the flu, do you actually go to the doctor or do you stay at home? And then finally, cost per utilization is what we end up paying per you going to the ER, going to the doctor and things like that. I'm showing you this because it beautifully illustrates that there is an old school way of managing risk, getting costs down, in a Oscar way, a new school way, so to say, of doing things. On the risk per member, what insurance companies love to do is what they call underwrites, which basically means not lets you in as a member if you look like somebody who'd be too expensive to insure. We think about risk per member in a different way. We think that we can actually get you over time healthier if you join us. We gave every member of Oscar this year a Misfits, connects to your mobile application right away and pays you $1 a day if you walk more than a certain number of steps. That's investing into wellness. The US general surgeon thinks if you walk more than a few thousand steps a day, you're going to get better over time. It's the investment we would love to make into ourselves, into our members. Utilization per risk, again, how many times do you actually go to the doctor per something being wrong with you? The old school, the old way of doing things, to deny stuff, to not even let you go to the doctor. The new school way of doing things is to manage care in a better way. We have nurses on the team here, we have doctors on the team here as well. We take phone calls to members, we proactively reach out to members who went to emergency rooms, who have chronic conditions, we help them navigate their care, and as a result, we think tons of better outcomes can be achieved by just somebody explaining to you in a better way how US healthcare operates. Finally, cost per utilization. The old school way of doing things is just say, hey, we're going to recontract some providers here. One of the first data analyses we did at Oscar was we looked at about 6 years worth of medical claims of doctors in New York City, and you couldn't find any connection between the quality of care you'd get as a member and the cost a doctor would charge you. It just wouldn't be correlated at all. If you buy an expensive car, you have some reason to believe it's going to be a great, fast, and probably even safer car. Not the case if you pay for an expensive doctor. Some are great and amazing. Some are not so great and amazing. And so one of the things we do, as opposed to just recontracting, is also to just reroute, help you get to the doctor who has the best combination of total cost of care being affordable and getting you healthy the quickest. A uniquely possible thing in a convoluted system like US healthcare. And the key to understanding all these things is, you ask yourself, why didn't anybody do this before? The answer really is, insurers have tried. You probably have received a flyer in your mail if you are a parent that's encourage you to kind of vaccinate your kids, which is very important to do. But you probably discarded it, didn't really look at it because it came months after you maybe should have taken your kids to the vaccination. It wasn't really very personalized. It didn't really speak to the situation you were in. It didn't tell you who you can go to get your kids vaccinated. The key for all of these things is start with member engagement. Get members to trust us and the help we can get them, the assistance we can provide them. And so, for example, in the case of vaccinations, we call members up who we see haven't vaccinated their kids, and we actively explain them who they can go to, what this will cost them, nothing by the way, and how all of this will work. And it really leads to what I think is one of our biggest bets, if you will. Member engagement reduces costs for everyone. Better wellness, not more rejections is what we want. Better management, not just more denials. Better routing, not more negotiating on the back ends. Those are the things you want. They speak to members. They make you feel like you have a better experience and get better healthcare. And in this odd combination, almost doesn't exist anywhere else outside of healthcare, it actually reduces costs over time.